Let's now discuss lung 9, source point. Lung 9 is located on the ventral aspect of the wrist at the level of the wrist joint space, the most distal wrist crease on the radial aspect of the radial artery and ulnar to the tendon of the abductor pollicis longus muscle. So how to find lung 9? As the location of the wrist crease varies, the ventral joint space between the proximal row of carpals and the radius ulna is a more reliable landmark for orientation. By loosely moving the hand, the joint space is easily palpable. Palpate the radial artery by means of its pulsation on the radial side and locate lung 9 on its radial aspect. Located on the same level are pericardium 7 between two tendons and heart 7 radial to the insertion of the tendon of the flexor carpi ulnaris on the pisiform bone. Needling of lung 9 is vertically 0.2 to 0.5 zoom. Caution, you have to avoid the radial artery. If the needle is pulsating, which is the desired effect, no need of additional stimulation. For actions and indications of lung 9, strengthens the lung, transforms phlegm, descends lung qi, regulates and harmonizes the vessels. So this is the relationship between zong qi and blood circulation. Lung 9 opens the channel, alleviates pain. Special features: Yuan-Source point, Shu-Stream point, earth point, tonification point, Hui meeting point of the vessels, important point for tonifying the lung qi and yin, especially with chronic disorders. Lung 9 is another major point of the lung channel. It is the main point to tonify lung qi and lung yin, especially in chronic conditions. Being the source and tonification point, it is eminently suited to tonify the lungs in deficiency conditions. We use lung 9 more frequently in deficiency rather than excess patterns, and for interior rather than exterior conditions. However, as its indications show, it can also be used for excess patterns. Use lung 9 to resolve phlegm obstructing the lungs, but in chronic more than acute cases with chronic cough with sticky sputum. The chest is the seat of the gathering qi or zong qi, which is closely related to lungs and heart. Lung 9 tonifies gathering qi of the chest and can be used in patients who are particularly qi deficient, suffer from cold hands, and have a weak voice. These last two are signs of gathering qi deficiency. When tonifying gathering qi, lung 9 is combined with Ren 17. Lung 9 is also indicated when all the pulses are extremely weak and deep and nearly impossible to feel, an indication that is related to its function of controlling all blood vessels. Lung 9 is the gathering point of all the blood vessels. The classic of difficulties in chapter 1 says, the inch mouth, which is the front position of the pulse corresponding to lung 9, is the great meeting place of all the blood vessels, and the lungs give impetus to the pulse. The front position of the pulse is considered the convergence point of all the blood vessels of the body, and for this reason, the acupuncture point on its site, which is lung 9, is said to influence all the blood vessels and the pulse. It is because of this nature that we feel the pulse on the radial artery, which overlies the lung channel. It is not by chance that this position was chosen as the best place to feel the pulse. It is because the lungs govern qi, and one can therefore feel the movement of qi within the blood at this position. Lung 9 can therefore influence all blood vessels and can be used for poor circulation, cold hands and feet, chilblains, and varicose veins. The lungs' influence on the blood vessels is a further expression of the close relationship existing between the lungs and heart. The lungs govern qi, the heart controls blood, and they mutually affect each other. Lung 9 tonifies lung qi and stimulates circulation of heart qi and blood in the chest. It is therefore also used to tonify heart qi and blood indirectly in such symptoms as breathlessness on exertion, listlessness, and palpitations. Lung 9 can be used to clear lung and liver heat in cases when liver fire overflows towards the chest, obstructing the descending of lung qi. It is useful to compare the actions of lung 9 with those of lung 7. So lung 7 is used for exterior problems, excess patterns, and has an outward movement, and it affects qi. While lung 9 is mostly for interior problems, for deficiency patterns, has an inward movement, and affects qi and blood. So lung 7 is for channel problems, better for emotional problems, good for acute conditions, opens water passages, and affects the bladder. While lung 9 is not so much for channel problems, not so much for emotional problems. It is more for chronic conditions, does not open water passages, and does not affect the bladder. Summary of functions. Lung 9 tonifies lung qi and lung yin, resolves phlegm from the lungs in chronic cases. It tonifies gathering qi or zong qi, and therefore lungs and heart, and it affects all blood vessels. Thank you very much for your attention.